Morning, my name is Courtney. I've been sitting here to talk with you about your recent diagnosis and to kind of help you understand things a little bit better. So, you've been diagnosed with diabetes mellitus. Don't panic, it's okay. I'm going to sit down with you today and we're going to discuss exactly what this means and how we can manage it. I'm going to hand you this pamphlet so that you can kind of read along with me to understand what I'm going through. And if you have any questions along the way, feel free to stop me and ask, okay? I'm going to walk you through exactly what diabetes is, how it can affect your body and life, and what some symptoms and treatment options are for you, okay? There's two types of diabetes. There's type 1 and type 2. To understand exactly what these are, first we need to understand what insulin is. So, the pancreas is an organ in our body, and that is responsible for producing the insulin. Whenever we eat or drink something, our body breaks down that food or drink into glucose, or in other words, sugar. This sugar enters into our bloodstream and signals the pancreas to secrete or release more insulin. Our cells need the glucose in order to function properly. Insulin is the key to allowing the glucose to enter into our cells instead of hanging out in our bloodstream. Now that we know what the role of insulin is, let's break down how type 1 and type 2 diabetes works. So typically type 1 diabetes appears during your childhood. However, it is possible to develop this in adulthood too. The pancreas secretes or creates little to no insulin at all. So your body's own immune system is going to kill islet cells in the pancreas. Islet cells are the specific cells that produce this insulin. As the islet cells are being killed and destroyed, they're not able to filter into our bloodstream to push that sugar into the cells that need it for energy. Now, type 1 diabetes is a natural insulin destroyer because it can't create the insulin that's needed for our glucose to enter into our blood. That means that there's going to be a buildup in our bloodstream of that sugar or glucose. Now, type 2 diabetes is similar, but not exactly. In type 2 diabetes, our own body is not attacking the insulin or islet cells. Instead, it is just not being either used properly or the pancreas isn't producing enough of the insulin in order for the glucose to be able to enter into our cells. And again, same result, there's going to be a buildup of sugar in our bloodstream, which is going to raise our blood sugar levels. Now, typically, type 2 is more common in older adults, but there have been recent studies that show that this is becoming more prone to childhood or adolescence due to the increase in obesity in America. Now, you might be asking yourself, how did you get this? How did diabetes come to you? Well, there's not an exact cause for that yet. However, there are some things that can lead up to this. So it could be genetics. Type 1, typically, if it runs in your family, then the genes can be passed along to you. There's no getting past that. However, type 2 can be because of your environmental factors. So this can be because of your diet. You may be eating a really unhealthy diet every single day of your life, greasy, fatty foods, lots of sugar. You might not be exercising regularly. You could even be smoking. You may have high blood pressure that has been uncontrolled for some time. All of these things can lead up to diabetes, but there is no way to find out exactly what caused your diabetes. Um, this diabetes is a pretty big thing. It can cause a lot of issues in your life. So you do want to get control of it. Some things that it can cause are going to be cardiovascular disease, which can be anything from a stroke to a heart attack, angina, atherosclerosis, a lot more. It can also cause diabetic neuropathy. So this is when the capillary walls in you they become damaged. When these capillary walls are damaged, it can cause tingling and a burning sensation. Can even result in pain or numbness that start in your fingertips or your toes, and they work their way up your body into your arms and into your legs. Diabetic nephropathy can cause kidney damage and kidney failure. Some symptoms of these can be your ankles start to swell, you're constantly fatigued and tired, you start getting nauseous and even vomiting. So be on the lookout for those symptoms and talk to your doctor to see what he can do about managing that. Diabetic retinopathy, that can affect your eyes. So the little tiny blood vessels in your eyes can be damaged because of the excessive sugar that is building up in your bloodstream, and this can weaken your vessels in your body. If those are damaged, you may start to have blurry vision, and if it continues to be uncontrolled, it could even lead to blindness. I know that's kind of scary. Stick with me here. There are other issues that can be caused by diabetes. If you have diabetes, you are at higher risk of hearing impairments, skin and mouth infections, Alzheimer's disease, and a lot of foot complications. You infections are a lot harder to get rid of when you have diabetes because your immune system is not working how it should due to your cells not getting the energy and sugar that they need to function properly. So your healing will be a lot slower if you do have any injuries or infections. So just be on the lookout for that and let's try to keep that sugar under control. Don't worry, I will talk to you a little bit later on about how we can control your blood sugar, okay? Now, it can also affect your daily living, not just the organs and parts of your body. So, in your daily life, yes, you may have to pause in the middle of your workday or your outing, or even wake up in the middle of the night so that you can check your blood sugar and make sure that it is maintained and that it's not too high or even too low. You may have to stop and take oral medications or insulin, depending on which type of diabetes you have. Typically, type 1 diabetes does require you to have insulin injections every so often or with every meal. You might even have to stop and eat a quick eat a quick snack or a drink just to make sure that your sugar is under control. Otherwise, it can cause you to be dizzy, tired, even pass out. You can get symptoms almost like you're a little bit drunk if your sugar isn't maintained, okay, if it gets too low. Now, your sex life. This is an interesting one. A lot of people don't realize that diabetes can cause a little bit of issues in the bedroom, okay? Now, for women, such as yourself, if you have uncontrolled diabetes, it can lead to vaginal dryness. It can make you not be in the mood for sex, causing you to even have difficulty orgasming. In men, it can cause impotence, which is erectile dysfunction, where the blood is not, you're not able to get an erection. Now, mood changes are very common with diabetes. You are at an increased risk of developing depression if you have diabetes. So, this can result in mood swings, lack of motivation to do your daily activities, and it can even affect your sleep and appetite if you develop diabetes. Now, there are some job professions that may limit you from applying to that position if you do have diabetes, especially if it's uncontrolled. So, for example, military, law enforcement, piloting, and even a couple of state jobs that involve driving big trucks can restrict you from having those jobs due to your diabetes. Diabetes is something that they look at very seriously. So, if that is something that you want to do in your life, I would recommend you talk to your doctor or even a therapist so that you can get it under control and hopefully still be able to apply for those jobs, okay? Now, the symptoms you may start to exhibit in your everyday life with with diabetes, you may be frequently thirsty and wanting to drink all of the time, can never get enough water. You may notice that you start to go to the bathroom every hour instead of every 3 hours. You may notice that your pant waistline starts to get a little bit loose there, and you're not even trying. You haven't changed anything about your diet or your exercise, but you've started to lose weight unexplainably. You may start to feel tired and weak, more irritable throughout the day. You may even start to get blurry vision. Remember when we talked about diabetic um, retinopathy, where your blood vessels in your eyes start to get damaged and it can cause blurry vision? That is a major sign there. If you do start to get blurry vision, that is what is going on, and you need to talk to your doctor fairly quickly, okay? You may even start to have more frequent infections. So, your gums, skin, even vagina, they may start to have more infections more often than you're used to. If you have never had a yeast infection before, but suddenly you're getting one every couple of months, that could be due to your diabetes. And again, in women, it can cause vaginal dryness, even irregular menstrual cycles, along with those yeast infections that I mentioned. Men, erectile dysfunction. Now, there are ways that we can treat this, okay? The main things to treat it are diet, exercise, medications. Unfortunately, type 1 diabetes can't be prevented due to genetics. However, you can alter your lifestyle choices in order to help keep your blood sugar more controlled. Type 2 diabetes, however, can be prevented if you continue to have a healthy lifestyle, healthy diets, um, and keep moving around, doing what you need to no smoking, keep your blood pressure under control. That can prevent type 2 diabetes. But once you have it, same thing with type 1 diabetes, there are ways that you can maintain and control it. So, for example, your diet, you need to eat more foods that are lower in fat and calories and higher in fiber. So, some really good examples of these foods are a variety of fruits and vegetables, whole grains, and even protein. 30 minutes of exercise a day. I know you're being told this every single time you go to the doctors ever since you were a little girl. However, there is some truth behind that. Exercise is a fundamental treatment and prevention for a lot of health issues in your life, including diabetes. So get at least 30 minutes of exercise every single day. Get your body moving, whether it's just walking down the road, going up a couple of flights of stairs, anything that you got to do, just get a little bit of exercise in, get that heart pumping, okay? Maintaining a healthy weight. I know everyone hates the BMI scale, but a healthy BMI of 18 to 26 is recommended for all individuals. So if you keep maintain that healthy BMI, that is going to help to maintain and control your diabetes as well. If you do have type 1 diabetes, make sure that you are regulating and dosing your insulin correctly for the amount of carbs and sugars that you eat with each meal. So, type 1 diabetes, if you're on insulin, every single time that you eat something, you need to know how many carbs you're eating because a certain amount of carbs will mean you take a certain unit of insulin. And you can talk to your doctor or even a nutritionist to help you maintain this and know what is the right dosing for you. There are also medications, oral medications that can be prescribed that can help regulate blood sugar. So, metformin is a really common one that people are on. This will help to get your sugar back under control if you take it regularly. But you still do, despite being on medications, you still need to control your own sugar with diet and exercise. Diet is the main thing, and I'm going to preach that diet, diet, diet. Eat healthy. Okay, if you have any questions, again, feel free to stop me throughout this. That is pretty much a summary of what diabetes is, how it can affect your different organs and body, how it can affect your lifestyle, the symptoms that you may experience, how you can treat it and manage it. Um, and is also a lot of research that if you would like to go on and look for yourself, I can provide you with some research websites to help you kind of do a little more research on your own and get to know your diabetes and what you've got going on and even what others are saying helped them. And here I've got one example of some current research that's going on. This is by Dr. Wong and a lot of other colleagues that he has and he's collaborating with. They're currently doing research to try to fully understand the blood glucose levels. Remember, blood glucose is the sugar in your body, and how to regulate the natural production of this. So, the current methods of monitoring our blood glucose are dependent on a specific enzyme that is constantly changing. That enzyme, since it's constantly changing, it's really hard to have one method and stick to it because that enzyme will not allow you to get proper statistics on your blood sugar. So he's developed this new molecule. They use a different approach to monitor blood glucose levels continuously. They can monitor it over a long period of time versus the current methods. And with his new molecule and his new development, he is hoping to continue his research and maybe even find a more permanent approach or treatment to regulate your blood sugar, maybe even find a cure for diabetes. Who knows? If you want to keep up with his research, there's a link at the bottom of this brochure here. You can go to that, read all up on that research he's got going on, and kind of stay up to date on what new developments that he's making. My best friend, she was recently diagnosed with diabetes. She is in her early 20s. There is no history of it in her family that she knows of, and she has never really had a bad diet. She's always been within a healthy BMI. She gets regular exercise. She does eat a lot of carbs though, pastas and sandwiches. So we don't know if that's what led to her diabetes, but again, as we discussed earlier, that diet is something that can lead to diabetes. She's struggled with trying to maintain her regular job and lifestyle along with adjusting her diet and having the time of day to map out every single meal that she needs to eat and be able to cook it and pack it up and keep it good, along with monitoring how much insulin that she needs to take after every single meal. So that's why I wanted to make this brochure so that I can kind of get a better understanding myself on what diabetes is. What I would recommend to you is that you talk to a nutritionist or even a life coach or even both. A nutritionist can help you map out what foods you can eat and what foods you can't eat. That can help maintain that blood sugar level that you're looking for. A life coach can help you to be able to organize your life so that you have the time to map out these foods, make these foods, go to work, go hang out with your friends, and still do everything that you want in your normal life without having to take away from it along while you're still monitoring and controlling your blood sugar and this diabetes. If you have any questions, please let me know. Now is the time. Otherwise, I hope you have a wonderful rest of your day.